What are the alternatives to mandibular advancement? If you or someone you know is dealing with sleep apnea, you might have heard about mandibular advancement. But what if that option isn't right for you? Let's look at some alternatives that could help. Mandibular advancement devices, or MADs, are popular for treating obstructive sleep apnea by moving the lower jaw forward. However, there are other choices available. First, let's talk about oral appliances. One option is the tongue-retaining device. This device uses suction to hold the tongue forward, preventing it from blocking the airway during sleep. While not as common as MADs, they can be effective for individuals whose apnea is mainly caused by tongue obstruction. Next, we have positional therapy. This method encourages sleeping in positions that minimize airway collapse. For example, avoiding sleeping on your back can significantly reduce apnea episodes. Another widely used treatment is continuous positive airway pressure, or CPAP. This machine provides pressurized air through a mask, keeping the airway open. It is the standard non-surgical treatment for sleep apnea, but it is not a direct alternative to mandibular advancement devices. There are also other positive airway pressure devices, such as bilevel positive airway pressure or auto-adjusting positive airway pressure, which adjust pressure based on your breathing patterns. Now, let's discuss surgical options. Maxillomandibular advancement is a surgical procedure that moves both the upper and lower jaws forward, creating a larger airway. This surgery is more extensive than mandibular advancement alone and is usually considered for moderate to severe cases of obstructive sleep apnea or when other treatments have not worked. Another surgical option is uvulopalatopharyngoplasty, which removes excess tissue in the throat to widen the airway. Genioglossus advancement is another procedure that moves the attachment of the tongue muscle forward to help prevent airway collapse. Additionally, hypoglossal nerve stimulation involves an implantable device that stimulates the nerve controlling tongue movement to keep the airway open during sleep. There are also other surgeries that target nasal obstruction or the soft palate, depending on the specific anatomical cause of the apnea. Lastly, lifestyle changes can make a big difference. Losing weight, avoiding alcohol and sedatives before bedtime, quitting smoking, and treating nasal allergies can all help reduce the severity of sleep apnea. In summary, while mandibular advancement devices are a common choice for treating sleep apnea, there are many alternatives available. From oral appliances to surgical options and lifestyle changes, it is essential to consult with a sleep specialist to find the best treatment for your specific needs.